And live from India and Brussels, it's ZN Live. And today I am very excited to have a very special guest, Dr. Naveen Thacker. He is a pediatrician with extensive experience. He's been working on polio, been working on vaccination, and he is now the president of the International Association of Pediatricians. We've actually been collaborating together on a number of projects, and I'm very, very excited to hear your thoughts on some of the critical topics that we're facing. Now, we've been talking about vaccination and the importance of communication, and you have been involved in launching a project, the Online Vaccine Trust, the IPA Trust project. Can you tell us why you think it's important to communicate on vaccination?
Yeah, so thank you so much, Philip, for hosting me here. The medical professionals and pediatrician in particular are trusted voice. People listen to them. People have faith on them, and vaccination is the biggest gift which we can give to the our children and to our population. And who best can talk about vaccination if not the trusted voice, the healthcare professional, and particularly pediatrician. So it is very, very important we talk about vaccination, we convey to people that why vaccination is important, because vaccination saved so many lives in the last few years, and particularly during COVID. If there were no vaccine, we would not have been in the same position where we are today.
Absolutely. And I think, something that people often forget, and I think pediatricians are aware of this far more than most people, is the power of vaccines to save lives and to save children's lives, to protect them. Why do you think doctors are finding it difficult to communicate in this space? What do you see as a big challenge that might be holding them back?
So the communication is never part of our medical curriculum. We are never taught in medical schools how to communicate. So doctors, if not trained, if not they don't learn, are very poor communicator, because we are always busy in seeing patient, and we never think it is important that we should also communicate. Communication is bioactive and it also helps. So because of lack of training and experience, we live in our own world, so we never have a chance to learn. We never think that communication is also can be, there are techniques of evidence-based techniques of communication which are effective. We never realize that.
Yeah, it's a very good point. And there was this Edelman Barometer Trust Survey, which showed that people had very high confidence in doctors and in scientists in particular. That was really important during COVID. So I think basically there's a big gap which you've identified in training, and then also in reluctance. Now, you've been personally active in communication. You've been on Twitter for quite some time. Why did you start communicating on Twitter, and what's been particularly effective with your own experience?
See, I have been talking about my lifetime work is on polio eradication and then vaccines. So I have been doing that for a long time. But then I realized if I really want to reach to the masses, I want to connect to the large number of people, then social media is the key, and Twitter is a very good place because that you can do fast. You don't have to be, and I have 83,000 followers on Twitter, and they communicate. I give short messages, and that's very powerful. People like that. Not going into the very complicated science, but what they need to do, and that's what is social media for. We can never reach to. I will give an example. One of my article was published in New York Times on polio and Time magazine, and within 18 hours I could reach to millions of people, which I could not do in 18 years.
Yeah,
So, so that's the power of social media, Twitter, and where you can have reach to the large number of people with your short message.
absolutely. And I think we've seen, you shared some examples of Twitter where you were retweeted also by Amitabh Bachchan, the Tom Cruise equivalent of um, the movie industry in India. And that helped to position you as a key influencer in the conversation on healthcare. So we got a couple of comments. We got Melissa saying happy Friday. Thank you, Melissa. We got someone saying such an honor to have you on the show. Such a good point. Also should be part of doctors' curriculum. And we have someone saying we have all experienced how painful it is when doctors are not good communicators and how amazing it is when they do well. And finally, Ivan saying, I agree, social media is a great way to reach many types of people and age groups. Now, I want to come back to your personal experience and how that led you to get involved in the online IPA trust, vaccination trust initiative. What was behind that idea? Why do you think it was necessary? And how successful has it been so far?
Yeah, so I have served on Gavi board in 2017-18. We started hearing even in Gavi board that the vaccine hesitancy is becoming a big issue. So I started working on that what do we need? And I assembled a good team of people where from multidisciplinary, not pediatrician, but other people who can be part of this. And we prepared this course. We had a training of trainer in India in 2018, and suddenly pandemic stuck, and it was such a need. People, the doctors were first for people to be contacted by media, but they were not prepared, and we had something which was ready. We converted that very fast into an online course, 7 modules in 7 languages, and then it was an instant hit because that was the need. People wanted how do we communicate, and we have a self-paced module, and we could reach to 165 countries, more than 7,000 registration, and now it is a published paper, and it was such an honor to have you as one of the faculty talking about social media. So it was needed. It was something which was ready. Almost it could be converted very fast, and it was timely, and people loved it because it was in their language, any language they wanted, and very simple, and something which is not with that time no agency was ready. Now we have so many people talking about all this, but that time nobody was ready, and we could reach out to the doctors, nurses, pharmacists, midwives, everyone, students.
Yeah, I think it was really interesting, and especially moving from the face-to-face training, which was conducted several times, and then, as you mentioned, this pivot to creating the online material. Now, I was very surprised to see how quickly people used it. So, as you mentioned, over 7,000 doctors from 140 plus countries. But it's not just that they were doing the training; it's also their high level of positive feedback, and that feedback was actually analyzed in a scientific study. Because a lot of people were very skeptical and saying, "Well, if you do it online, people are not going to engage; they're not going to get the same output." And I think, actually, very interestingly, you have demonstrated through this initiative that people really are happy to consume it. And imagine, the amount of people that you were able to reach. And we're talking about HCPs, people in the profession, through that channel. So, do you think that this is going to encourage people for getting better at doing this, or are a lot of people kind of tempted to go back to face to face? What is your feeling about the future of online training and communication, for especially for vaccination?
So, see, it is going to be, if it is any training, people now are very used to this, and they have see, as you said, we reached to 7,000 people, but don't forget that we have every one person would have used this in their own setup. and this must have reached to 100 times more than what we have we see the data. And as you have said, it was very well documented that this was very effective. There was concern that from the low income countries, they may not be able to access that because of low bandwidth, but that was not the case. We have data to show that that was not a barrier from any country, and we have reached to even very such countries in large number. So future people are not going to travel now for the say online say training or for attending meeting. That's now they will do to it to prefer online, and self-paced courses will be best because everybody is busy. People will travel for the meeting each other, for tourism, for enjoying and meeting people, but not for the training. They are very comfortable in taking this online training. So the future is great. We can do so many courses now, sitting at home at our own convenience.
Yeah, I think it's a very good point. And the way people have now become more used to online training and seen that effectively the content can be delivered. And of course, you can deliver live discussions, commentary, you can go much deeper. But I mean, it fundamentally helps people who can't travel because of time, because of budget. And basically, these courses require quite a lot of material. So it's and repetition and additional material. So I think you need that follow up and that continued education, not just the one-off event. So I think that there's a lot of potential there. Now, there was one more question I had on the social media experience that you had, because I know that you were the first person in your state of Gujarat to get the COVID vaccine, and you then did a video of you cycling and talking about the fact that you were fine after the vaccine. What was the experience, and why did that video get quite a lot of traction after it was released?
Yeah, so that's very interesting. I was called by Chief Minister to, and I offered to be, because people were skeptical. So I said, "What's a big deal? I will take the first shot." And then I was given the first shot of COVID vaccine in Gujarat in front of more than 150 media people, and then people started asking me, "How do you feel?" I said, "What's a big deal? It's a shot, and I'm fine." Then they were following me, BBC, Gujarati, and so many TV, after 24 hours, 48 hours. So on third day, I was on my bicycle, and I just posted a video that I have taken COVID vaccine and I'm perfectly fine. And that was picked up by UNICEF and then Ministry of Health and Family Welfare India, and that has received 65,000 likes. So that's the power of media. Very simple message: I have taken vaccine and I am alive and healthy, no side effects, so go for it.
Yeah, no, I think it's great. I mean, the message was clear and simple, which is also important, because sometimes and around these discussions, things were very complicated. So people got confused. They didn't understand all the data. And what they really need to hear is it's okay if a doctor that you trust is willing to do it, then you can trust it too. So I think that was a very powerful message. Now, the IPA, the International Association, the International Pediatric Association, is an incredible network. I mean, it represents doctors that, I think everyone is in contact with at some point in their lives, over 1 million pediatricians. What are your ambitions for this organization? I know that you've been a very innovative, very driven leader before of IPA India. What do you want to achieve for this new mandate that you have? What are your ambitions?
Yeah, so thank you so much. So my goal is very simple. The theme which we have given for my tenure is reaching every child. And how do you reach every child? We as a IPA cannot reach that. So I want a pediatric society in every country. We are already in now 165 countries or so. I want to connect all pediatrician, 1 million pediatrician, connected together and working together. So we are going to create a unique ID for 1 million pediatrician, offer them some content on IPA website so they feel connected and they feel that there is something for them. After that, we will go for parents and public and media. But as of now, first aim is to connect 1 million pediatrician with IPA, with one unique ID, through them reach to the children, and whatever is needed for the children, we can. Our mandate is through pediatrician and partners, so we will do that. So very simple. We issued a call to action and commitment. We will do everything what is required, but for that, first we have to reach out to pediatrician and pediatric society. Then only we can reach to the children.
Fantastic. And I think, the key to those very ambitious goals is communication, of course, because you need to reach all those networks, all those doctors, and the parents that you need to reach to reach their parents. So I think getting the message to people, explaining why is really critical. Now, one more question before the communication. What would be your tip for young doctors who are beginning the profession today? What do you think they need to do that maybe nobody told you to do when you started your medical profession?
Yeah, so for the young generation, I would say follow your passion, and everything is possible. Everything is created twice. First in your imagination and then actual world. Follow your passion. It will take, as I said, it took 18 years for me to get recognition on polio, and then it was done in 18 hours. I was known, could reach to millions of people when Mr. Bill Gates, UNICEF, they tweeted my New York Times article. So don't be disappointed if you are not getting recognition. As one of my friend, Samir Dalwai always says, the instant success takes 25 years. So there is nothing like instant success. It takes time, but there is someone somewhere, they are watching you. Continue with your passion and never give up, never compromise on your passion, and you will be successful. You just continue with what you are doing.
Fantastic. I think very good advice. Now we have time for some recommendations.
Yeah. So I would.
Sorry, just had the jingle. So what is your recommendation, Naveen?
Yeah, so I would say take up the IPA Vaccine Trust course. This is useful to everyone. I have heard my colleague in US that because there is an interpersonal communication module, social media module, which you can use in your daily life. So just register it. It is open for everyone. It is free, available in 7 languages. Please go ahead and register, and you can take it at your own pace, and you will get a certificate from. Once you complete, you will get a certificate from IPA.
Yeah. No, I think it's a very good suggestion. And as you said, there's a lot. I mean, it's great, of course, for HCPs, healthcare professionals, and anyone interested and active in conversations around this. But the interpersonal modules about psychology, about kind of behavioral psychology and communication are fascinating. And of course, we have one on social media that I have been involved in. Now, my recommendation is actually a book called Building a Second Brain by Tiago Forte. This has been something that I have been kind of reading on and off for a few years, and I'm coming back to it now. The idea is very simple. We today need a second brain, and by second brain, Tiago means a digital capture mechanism for all the things that we learn, that we come across, and he's trying to create a method for how we can do that using digital note-taking apps, but not just capturing the information, but kind of organizing it so that it can be retrieved in an easy way. And it's a very simple idea, but very powerful and actually quite challenging to do, because with all this digital data, we all face a lot of information. So finding a good method is a big challenge. A lot of videos on this online if anyone is interested. Now, that is all we have time for, but it's been fantastic to have you on the show. Naveen, your advice and your actions are inspiring to doctors and professionals everywhere. I think that you're pioneering a lot of breakthrough initiatives in the medical field, in communication. And the great thing is those can really change people's lives, and they can protect and save children's lives. So thank you so much for what you do. And we will see you online, and we will see you later. Thank you very much. Have a great weekend.
Thank you.